Those at risk due to underlying factors, there are three principal groups who are at risk of hepatitis B as a consequence of their underlying medical condition. People who regularly receive blood and blood products are not at risk of acquiring hepatitis B infection through this means in this country, but they are at risk of acquiring infection in countries where infection control measures are suboptimal. Now, people with chronic liver disease, perhaps due to hepatitis C infection or autoimmune disease or excessive alcohol consumption, are at risk of exacerbating their condition if they also get hepatitis B. And patients with chronic renal failure are at risk of contracting hepatitis B through dialysis because of the invasive nature of the dialysis setting. And outbreaks of hepatitis B in this setting used to be commonplace before the introduction of vaccination for both staff and patients. Immunisation in renal failure. Vaccinating patients with chronic renal failure is particularly important because such individuals are more likely to develop chronic infection if they're infected, and the reason for this is their immunocompromised state. And because they have an immunocompromised state, a higher dose of vaccine is required to ensure that they achieve a satisfactory immune response.